Hey guys, this is Jason Torado, your West New York chiropractor, and as stated before in some of the my other videos about low back pain can actually come from many different types of structures. One of the structures is something called lumbar facet syndrome, and it's one that involves the facet joints inside the spine, inside here, right inside there. Here's the discs, here's the vertebrae, here's the spine, right, and that can come from old injuries and also new injuries. You know, the facets inside here are really synonymous with the zygapophyseal joints, and really that's just a big $10 word that a lot of doctors use that mean the facets, so don't let that throw you off, all right? You know, about 45% of the people that come inside my office with chronic lower back pain actually have problems inside these joints inside here, inside these facet syndromes, and it's what's really causes lower back pain. You know, there are a lot of conditions inside the spine that actually can give rise to facet syndrome, and some of these include, let's say, straining of the surrounding joints right inside this area. Also, joint hypomobility, that means lack of movement inside these joints. Sometimes people can actually have a cyst inside here, like a big synovial cyst, and sometimes it could also have arthritis inside here, or some doctors like to use the word osteoarthritis or degeneration. But because the facet syndrome can actually accompany other conditions, a lot of times the doctor of chiropractic really has to evaluate each patient individually, and each patient has to be managed completely different. There's no standard for treating people with facet syndrome. So, for example, in pure facet syndrome, well, actually, let me just tell you how you know when you might have facet syndrome. In pure facet syndrome, pain rarely ever passes past the level of the knee. Okay, so it never really goes past the knee, and it does not really cause any type of neurological loss like numbness or tingling or maybe weakness or loss of reflex, which is what you typically find in something like sciatica or a pinched nerve. Now, sometimes it can create a little bit of numbness, but it's never really beyond the knee. Pain's not usually worsened by any type of hip movements, such as straightening out your leg or raising your leg or even rotating your hip. So sciatica is completely different. Sciatica, you straighten out your leg, you have a lot of pain. Sciatica, you also have pain radiating down the leg along the course of the nerve. Just remember that the facet's job is actually to limit twisting inside the spine and guard the spine from twisting, over twisting inside that lumbar spine. And the lower lumbars facets are really shaped in such a way that it actually limits motion when bending forward or backwards, right? So those facet joints are really, really unique because they're supplied by these specific nerves, not the sciatic nerve, but specific nerves that can actually be blocked by injecting some type of anesthesia inside here to determine if that facet is really the main source of pain. So you could really find out what is the main source of pain if you have a facet problem. And in many patients, an injury to a facet joint is usually the result of some type of small little microtrauma over like a long period of time. Okay, it doesn't necessarily happen like right away, and it's not a single isolated accident, right? It's something that takes place over time, and then those facets get inflamed and it causes a problem. So for me to give you an example, repeatedly bending forward and backwards, bending forwards and backwards and twisting the spine, like let's say a construction worker, right? And then, or maybe even leaning too much to one side, like this side, right and left all day. That can stretch out a joint and can actually damage that ligament capsule where that facet is, until finally these tissues inside the lower back, boom, they just give out and it just generates some type of crazy pain, and you got to go see the chiropractor. You know, over time, a lot of these joints will actually become arthritic inside there when people, let's say, 50 to 60 years old, and that could be a problem. And some doctors call that osteoarthritis, and it's that osteoarthritis that starts to result in narrowing of these joints where the nerves come out, and this space inside here gets all jammed up inside there, and it's one of the main reasons why a lot of older senior citizen people will actually walk partially bent over, right? It's crazy. You see them walking down the street and they're hunched over, and you're wondering, how do they ever get like that, right? But the reason why they bend over like that is because it just feels good to them. So here's the good news, right? That's all the bad news. The good news is that it's not always a permanent condition. And with my specific method of chiropractic treatment, it's a highly effective treatment for people that suffer with this facet syndrome. And most patients feel better within just a few visits, or maybe even a week or two or second week of care. All right, sometimes even within 4 or 5 visits. So that's all I want to talk to you guys about for now. This is your West New York chiropractor watching your back. I'll see you soon.